Just about 10:30 here in the East, and we are awaiting an announcement by Vice President Joe Biden, along with Health and Human Services Secretary Kathleen Sebelius. You can see the microphones are all set up. They are expected to announce that they've reached a deal with leaders from hospital industry trade groups on part of health care reform. The Washington Post reports that hospitals across the U.S. will cut $155 billion over the next 10 years, that they've managed to find that much in savings. And that money will go toward insuring people without health coverage. So we'll see how this affects health care reform in general when they take to the microphone.
On the surface, it sounds pretty good, huh? Saving money, trying to get under that $1 trillion figure that everybody's been throwing around for the last couple of weeks. So you've got the hospitals out there. What are they getting in return? And what will the American taxpayer get in the long run? House Republican Conference Chairman Mike Pence out of Indiana is with me now. Sir, good morning to you and welcome back.
Good morning, Bill.
On the surface, it sounds great. These hospitals got together and said, yeah, we'll do the deal for you. You know, we'll take a $155 billion loss over the next 10 years to do our part. What do you make of it?
Well, I think my response, as you suggested, would be not so fast. Look, you know, if in fact in a few moments we hear that the White House has managed to secure a commitment for $150 billion in savings, that's about 10% of the cost of the Democrats' health care plan. It's projected at about $1.5 trillion, and the hard truth here is that what we may be seeing today is another industry, kind of like utilities, financial firms, bondholders, auto dealers, you know, being marched out by the White House, having come to some voluntary agreement that's dictated by the White House, and at the end of the day, 90% of this cost is going to be borne in the form of taxing the American people. You know, I think the reason why the Democrat health care proposal is in disarray right now is because, you know, millions of Americans like the health insurance benefits they have today, and they know that either a government insurance option or taxing of benefits are both going to result in them losing their insurance or paying higher taxes.
If you put the hospital deal with the drug companies deal that they cut about 2 weeks ago, they say they're willing to save about $80 billion in savings. If you take a little piece from here and a little piece from over there, eventually, I mean, a couple billion here and a couple billion there, eventually it's real money. Why does that not sound like a good idea? Because what it appears anyway, whatever the White House is getting in commitments behind closed doors, is that everybody's got some skin in this game to try and lop off that overall price figure.
Well, number one, you know, there are voluntary agreements and then there's less than voluntary agreements. I'm kind of reminded back during the days of the Wall Street bailout when a lot of bank executives were hauled into the previous administration's White House and told you are taking the TARP money, and they all walked out and said, you know what, we are taking the TARP money. You know, as a limited government conservative, I'm not comfortable with the federal government securing voluntary commitments from the private sector. But look, if there's savings, you know, through the pharmaceuticals, if there's savings today through the hospitals, great. But your viewers ought to know that this is a $1.5 trillion plan, and they're going to announce today with a lot of fanfare that they found a way to pay for about 10% of it.
So
and the other 90% is going to be borne by the American people in higher taxes.
At the moment, based on what we know, you're not a buyer.
Well, I'm not a buyer in a government takeover of our health care in this country. I really do believe that the American people know that we ought to deal with the issue of uninsured. We ought to work harder to make health insurance products more affordable and more available to more Americans, but we don't need a government insurance option. We don't need a government takeover, and for heaven's sakes, Bill, we don't need to start taxing the health insurance benefits of millions of Americans, which is exactly where most Democrats in Washington are going to go to pay for the other 90% of this bill.
Let's tackle that here in the short time we have left, because apparently some of these Democratic leaders went back to their home districts and home states over the July 4th weekend, and they were stunned by the earful they got from their constituents. One of them even came back and called it sticker shock. And now this is the taxing idea of employee benefits that even Senator John McCain proposed first during the campaign of last year. It appears that it is a major sticking point that's allowing these committees just to wallow and turn themselves over continuously day after day, and bumping up against that deadline that they set for themselves for August recess to get this thing done. When you just look at that at the surface, it seems like health care reform is a very difficult proposition to get through this Congress.
Well, I think it's a very difficult proposition to get a government takeover of health care in America, not just through the Congress, but by the American people. I mean, look, the reality is, and the Lewin Group study found this out, that they recently adjusted their number. I think they're now projecting that if we have a government-run option, combined with this plan for taxes, I suspect, on benefits, that about 114 million Americans who currently have health insurance through their employer will lose their health insurance. And I got to tell you, I've always thought these recesses that we take, like the last one Congress just had, are the real antidote to Potomac fever. Ideas can seem to make sense sometimes here on Capitol Hill, and you go home, and as we say in Indiana, you got another think coming. And I think the reason why Democrats in Washington and down at the White House are in disarray on their government takeover of health care is because the American people are being heard. They're being heard in increasing measure. They don't want a government-run option. They don't want a mandate. They don't want to tax benefits. And no amount of window dressing or this announcement today by hospitals and the administration is going to change the fact that all those things are coming if the president gets his way on health care reform.
Mike Pence, thank you. The view from the right. We'll get the view from the left, and Joe Biden steps to the microphone in Washington in a matter of minutes here. Mike Pence, thank you. Republican out of Indiana. You got it. Megan?